Maria and
Gina, I'm back.
Reflect and Reset with Maria and Gina. And this time I have Gina.
Yes.
Because last week I missed her. She couldn't join me, but I'm happy to have you back,
And
partner.
it's like she's missing like a side of her.
I know.
The better side.
She's the joker, okay? But that's what we miss. So thank you for joining us, as always, on Wednesday at 5 o'clock at your favorite show. And we want to thank you for the support that you've given us. We have a very special guest today, and we're going to be talking about telemedicine.
Mm-hmm.
So Gina.
Yes, so we have Sam Virk here from MediSprout Telemedicine, and we're going to learn a lot about what the new upcoming features of telemedicine, how it works for you.
Sure.
So why don't you, first of all, tell us a little bit about yourself and how you got into it?
Yeah, absolutely. Thank you for having me. It's a pleasure to be here. So I'm originally a physician, trained in neurology and interventional pain management. I was in private practice for many years, and one of the things I realized in my practice, I had tons of problems that I was dealing with in practice, like whether it's billing or staffing. There's always issues, right? And in healthcare, one of the things we always try to do is find a common solution to address multiple needs, right? So for many years, I would think of different ways to solve the different issues I had in my practice. And one day it occurred to me that it's actually one main issue that needed to be addressed, and it was communication, right? Communication was the biggest issue that I had in my practice with my patients. It was a barrier. I had a 10-minute, 15-minute visit if I was lucky with my patient in the office. 4, 6, 8 weeks, sometimes 3 months would go by. I wouldn't know what was happening with them. And then they'd come in and it would just be trying to recoup, what occurred in the past 3 months. I needed a better way to communicate with my patients, and they needed to communicate with me. And when I saw, people starting to use FaceTime and Skype to communicate, I said, why can't I do that in my own office? And I went out and I created my own. And we're trying to embed it into doctors' offices to improve communication between doctors and their patients.
And why don't you tell us, because people realize that telemedicine is face-to-face on a phone, like a FaceTime, but how does it work?
Correct.
For a patient, like what would the patient have to do to?
Absolutely. So in this case, we set it up to be like a scheduled Skype call. Your doctor, they might see you in the office, and after the visit, they may say, you know what, your next visit doesn't necessarily have to be in person. We're just going to schedule you for a video call. And you don't have to know what happens at the doctor's office, but the point is they go to their computer, they schedule a visit with you, and you receive an email notification that says you've been scheduled for a video call with your doctor. And you click the button to go into your account, and you click start video call button at the time that the visit is scheduled. It may be next week for 3 o'clock, and you just push start video visit at 3 o'clock next week, and you're on a video call with your doctor.
And I love the telemedicine because there are so many visits that you really don't have to physically go to the doctor. I can tell you we're very busy. So you're trying to run a business, you're trying to run a family, go and take the kids to piano, whatever it is that they have to do. Sure. And then you have to fit a doctor's visit. But if you're not going to physically be examined and you're going to have a conversation, I mean, that's like an easy telemedicine visit, right?
Simple. It's easy.
Yeah.
We estimate across multiple specialties and practices, today 1/3 of all medical office visits can be virtual, right? Yeah. So in this country, there's 1 billion medical office visits a year, more than 1 billion. And 300 million of those, you shouldn't have to get in a car, you shouldn't have to sit in a waiting room, you shouldn't have to leave your children. You should be able to sit in your house or at work and do the call. There are imaging follow-ups, lab follow-ups, medication adjustments. They're simple things that we can virtualize.
But if someone's coming in for an appointment, like they don't feel good, they think they may have the flu or strep, then they should visit the doctor.
Of course.
Can they call first to say, these are my symptoms? No, you don't, really.
Absolutely.
Is it something that...
So part of our service, actually, one of the other issues I had in my practice was, scheduling follow-ups was one thing, which I touched on, but the patient phone calls, right? Patients need your help in between visits, right? Those gaps between visits. And right now, in most offices, it's this kind of like back and forth phone messaging. hard to accomplish good care, right? So what we did was create a mechanism for patients to schedule a video call with their own doctor so that they can address their needs between visits, right? So you're at home, you're sick, you feel like you might have the flu, you schedule a video call with your doctor, and the best part is if your doctor feels like, you know what, I'm not comfortable doing this on a video call, just come in,
Yeah.
right?
Yeah.
So that's the backup.
But consultations, like for example, if you're gonna see a doctor because you have cancer,
Yes.
an oncologist, and you've already had all your tests,
Sure.
so you're actually gonna sit there. Now, it could be emotionally you wanna be there for the
Mhm.
first visit,
Of
for
course.
the consultation,
Yes.
but after that, when you're just getting guidance,
Yes.
this makes all the sense in the world.
It makes all the sense in the world. It's a great specialty where this is the application of telehealth in oncology for people with cancer. These are sick people. They get, if they're going through chemo and radiation, some of them can't leave their house, right? And all they're looking for is support, guidance, right? And that's invaluable. And I think we discount how important that is. And it can be done virtually, absolutely. Yeah.
The phone they need to have, it needs to be a certain type of phone. I just wanna make sure, because this is
Yeah,
a question
good point.
probably that I'm thinking.
Great point. Any phone, any device, any phone, any iPad, computer, it works on all devices as
But
well.
it's secured on your end.
Yes, so we've gone through, so one of the questions we get is why can't I just do Skype or FaceTime? In healthcare, we have privacy and security standards that the government has put in place, and you have to go through a verification process. It's called HIPAA, HIPAA compliance, right? So we've gone through the HIPAA compliance process, and the video is encrypted. The accounts are secure. We use what are called Amazon secure web servers in case anybody's concerned about the security aspects. So yeah, it's a secure environment. Yep.
As far as, so one of the biggest issues that I'm seeing with us, with our patients,
Sure.
is that mental health is a big issue.
Sure.
So we don't have access to mental health, and we have an organization that just opened up, and we were sending patients to them, and out of the blue they say, well, we can't because we don't have one of the provider left on disability, and we don't have enough providers to be able, doctors to be able to see your patients.
Absolutely.
And I'm like, so what do we do? But that is like another teletherapy.
Yes.
Would be a perfect example.
Perfect.
For telemedicine, right?
It's a great way to get started in telehealth because the in-person visit, it's conversation, right? So there's two parts to the teletherapy is the video is important, right? So many people say, oh, just do it why can't you just do it on a phone call, right?
Yeah.
You need to visualize the patient, right? When you have two senses involved as opposed to one, it is an exponentially greater amount of information that you can process as a clinician, right? So in this country, I think everybody knows the statistics in terms of the shortage of mental health services, the lack of continuity of care, the way that our emergency rooms are being inundated with people who need help and they're not getting it. There's an amazing opportunity here to provide mental health resources to patients for clinicians. It's a great way to get started.
And the nice thing is that it's a lot easier to schedule because the mental health provider could be home and carve out a few hours at home while they're making dinner or before they're making dinner. So they're still in their lives and they're not running from place to place to place.
Yeah, absolutely.
And it's also easy, like I said, for the professional.
It's easy for the professional. I think, so when you look at it from a mental health standpoint, right, you can look at it as simply as a product, a consumer and, a provider, right? So the provider has a certain number of hours that they can help people. Right now, our providers are not maximizing their time, right? So if you can give a provider who sees people in person the option to do video consultations, they can make their time much more effective, right? They can fill in the gaps where they're free. And those patients that are sitting in ERs and in group facilities waiting for help, it's just a matter of making the connection, right?
So does insurance cover this? How did the patients pay or we get paid as providers?
Sure. This is, I could spend an hour talking about reimbursement, and what that speaks to is the complexity of the reimbursement structure right now. It's really difficult, and this is one of the barriers to why telehealth is not I think, growing as quickly as it should because the reimbursement structure is complicated. I'll try to give it to you in a really quick, easy way. First of all, it varies by state. Every state has different regulations with regards to telehealth reimbursement. And then within each state, it varies between private insurers, Medicare and Medicaid. So you can, and then even another layer within that is within the insurance companies, the reimbursement structure varies. So you have multiple layers of complexity, and there's no standardized way for reimbursement. Since we're in New York, I'll just touch on New York. New York has relatively progressive telehealth legislation. The state mandates or requires private insurers to reimburse for video calls. So if you see a patient and you do a video call with them, you have to, as an insurance company, pay that provider. Some states don't have that, right?
So Medicare pays for that?
Medicaid, so then Medicaid will. Medicare has very complex rules for reimbursement. They require.
That's crazy.
It's crazy. It's frustrating because as a provider, you desperately want to help these people, but nobody can work for free, right? And providers are already spending a very small amount of time on patient care. So, so with Medicare, there's some obscure rules.
If you can speak up a little bit.
Sorry. Yeah, absolutely. And for Medicare, there are obscure rules where the patient has to be located at a qualified facility, right? They have to be in a doctor's office, a skilled nursing facility, an approved group home.
The patient.
The patient has to be. It makes no sense.
Defeats the purpose.
It defeats the purpose. The legislation isn't where our technology is, right? Now we have smartphones. We're walking around. That legislation was based on a time where, as a facility, you'd have to go out and spend $10,000 on hardware, on a camera, and on a monitor, and patients would have to come there, which it made sense, right? But we're past that. So we're hoping that in the next 2 to 3 years, Medicare will move forward quickly. They're making some progress, but again, it's complicated.
I mean, Medicare patients, you know, as you get older, it is harder to mobilize yourself. I know that nowadays, but you know what I was just thinking? So nowadays, most insurance pay for the patient to be transported to a visit.
Oh,
and
really?
it could
Probably
be
more expensive.
It could be a regular visit. It doesn't need to be. If they could have their
Yeah.
physical exam.
Got
There are many taxi or companies that have developed with this new thing, and they have contracts with the insurance companies.
Got
So
it.
I just thought about it, like, that makes no sense.
It makes no sense. If they're willing to transport, why won't they pay for
Why
it?
would you not pay for the telemedicine?
Yeah, no, you're right. This is
Wow.
where healthcare is it's so starkly different than everything else we do in our life, right? Like we book travel online, we get food delivered online,
everything.
we bank online, but we still have to pay a taxi to take me to my doctor for a visit that doesn't need to be in person, right? It's you're right. It doesn't make sense.
And they're actually going to pay you more
Yeah.
for the patient to come to you.
Wow.
You
It's
know,
amazing.
and they just don't know dollars and cents.
Yeah.
in there.
I've
Penny
always
wise,
wondered, like,
dollar
who are
Sure.
who are the people making these decisions?
Yeah.
Are they doctors,
Yeah.
are they, and I think part of
Yes.
lobbying, I don't know how much the telemedicine world is lobbying,
Mhm.
or, because you need to have
They're-
really good lobbyists,
Sure.
right?
There is a lobby. It's called the American Telehealth Association. It does lobby, but unfortunately in healthcare there are so many very strong lobbies that don't want things to move very quickly. I can talk about those, for the whole session. But the point is, there's a lot of people who are not interested in changing healthcare because they're benefiting from the current structure, right? So
That is true.
I mean, like anything, it will take time. It'll take time, but we believe that as long as you're doing the right thing, it will change.
It's actually, all the insurance companies have you following your, the care quality,
Yes.
right? So we all have these quality assessments.
Sure.
And to be able to follow your patient on a more consistent basis through telemedicine,
Yeah.
it would make no sense
Yeah.
not to
Not to.
enforce this,
Yeah. Exactly.
you know?
Telemedicine. It's good healthcare. Honestly, it really is because one of the issues with our healthcare system is it's reactive, right? Our system is generally focused around the idea of, oh gosh, something is going wrong, I need to get help now, right? It is not a proactive system of prevention. Telehealth is an opportunity to turn it into a preventive system of healthcare where a patient can do a quick visit with a doctor and say, if they're diabetic, they can just have a video call and say, you know what, I'm going to be traveling and my diet's changing, what should I do, right? As opposed to figuring it out afterwards when things have gone wrong, right? So there's a real opportunity to make it a proactive healthcare system by using telehealth and avoid these
Have
issues.
you ever gone to speak in front of the government about
I
lobby for it yourself?
I haven't yet. It's interesting. I've been speaking to some people in the state level who may have me speak to government officials. Government's supposed to protect the people, right? That's their job, right? To make sure its population is taken care of. And I don't believe government yet understands how telehealth can impact the population and be a way to change our healthcare system. So I'm hoping to be able to do that on a governmental level as well.
I think that, someone with your knowledge, getting out there and speak for the people,
Yeah, no,
it's huge.
It is
to do
huge.
that.
I would be always open to advocating. Our company is based on obviously technology, and it's based on selling a product to doctors' offices, but the mission is really about better healthcare and reducing cost of care. If you go to the website and check it out, that's what we talk about on the website.
What's your website? Tell them so they can go check it out.
It's MediSprout.com, MEDISPROUT.com. There's some interesting videos and information on the website as well for people to check out and learn more about it.
We're actually, one of the reasons we invited Dr. Burke here is because we are going to try it for the first time. So we have Dr. Bachelari, who is a longevity doctor. You've started to see some of the videos. We are going to do IV treatments. And what he does is, prior to sort of creating a plan for you, he is going to have a consultation. Perfect example, you don't need to come. You can just connect with Dr. Bachelari through telehealth.
Sure.
And then there will be other consultations that he'll be able to do.
They also,
that you don't have
for
to
Dr.
go.
Bachelari, he also sends the Quest to your home to take your blood.
Yeah.
So he can get all the results. You don't have to leave your house.
No, this
Which is a beautiful
is
thing.
great. So we're very excited to actually try telemedicine for the first time. We have been speaking for a year. And before we started the show, I was actually talking to you about what are the major blocks. Like we've been talking about telehealth for so long, but it never takes off to the level that we are thinking that it's going to. And this year, remember we were looking at an article, and I think it was Forbes magazine that they have a predictor, a healthcare predictions for 2020, and they do this every year. So this year they were predicting that this is the year for telehealth, that is supposed to really grow. But you were saying that they've been predicting this for many, many years, and it hasn't happened. So tell us why.
There's many reasons why. There's reasons from large scale reasons, governmental and industry, to everyday practice, right? So through all those, so from the governmental standpoint, we were just touching about the reimbursement for Medicare, right? When you go into a physician's office who has mainly a Medicare population, and when the conversation generally ends once you say, I don't have a great way for you to get reimbursed for this. Patients can pay out of pocket for Medicare, right? But of course they're on Medicare because they can't afford to pay out of pocket, right? So that's one barrier, is the reimbursement structure. The second is, if you go into a practice, most practices, as you know, are just busy. They're swamped, right? Things are so hectic, they don't know how to fit it in to their regular practice, right? So we've tried to come up with solutions where it can complement what a practice is doing But the point is, the other reason it doesn't take off is because they're so busy, right? But when you actually speak to a practice about why they're busy, it's a bit eye-opening, and we've seen it change the tide, right? So right now the statistic is doctors spend 27% of their time on patient care, right? So in their day, out of this 8-hour day, 2 hours is spent with patients, and 6 hours is spent doing notes and other stuff, right? How we frame telehealth is to try to overcome that barrier is if you can take your follow-up visits and make them virtual, you can actually spend more time with your patients in your exam rooms, right? You can increase that 27% to 40% possibly. It's not a lot, but it's at least a movement in the right direction. But the point is, offices are busy, and it takes them a little while to realize that they can actually incorporate it and make themselves more efficient, right? The other barrier is the medical legal barrier, right? Most people have the misconception that there's liability associated with telehealth, right? Oh, I'm going to get sued if I do this. It's not good patient care. And it's all education. Once you educate clinicians and practices about, hey, there's the level of litigation is less with telehealth, right? It's your patient and you're actually in control, right? So if you're not comfortable doing a telehealth visit, you just tell them to come in person, right? So from the liability standpoint is another barrier. So those are the three main barriers, the reimbursement, the liability issue, and just everyday implementing it in a practice is hard, right?
Yeah.
The idea sounds great, right? But where the rubber meets the road, it's challenging. It is challenging. I love going into a practice, and I love saying, just do the right thing. That's how I'm a big believer in. If you do the right thing, if you really believe you have made the right decision, that can follow you into any explanation you give if somebody questions you. I was just doing the right thing for my patient, right?
Yeah.
And if the insurance company denies the claim, hey, I was doing it. You may have to fight it, but it's going to be a fight. There's going to be a fight, right, with the insurance companies, with Medicare. Who's willing to take it on? Either we have to take it on as practices, or if we want to provide that care to our patients. But it's not going to be simple.
So do co-pays apply? Do you know?
They do.
They do.
They do.
So this is a visit, so it's just like walking into the doctor's
Just like
office.
walking into the doctor's office, exactly. I'm a big fan of, in an ideal world, I would love to have doctor's offices just charge their patients out of pocket for telehealth visits. Set a set fee, $50, $40, $70.
Smart, that's the way to do it, I think.
Yeah.
You set your fee, whatever you want, based on your patient population, your demographic, and say, because so many people have high deductible insurance plans now, right?
Yeah.
And
You're
they're looking for most people
have
do
been
now.
deductible. Yeah.
Right, I don't remember the exact number, but it's close to 30 million people now, plus more than that, probably close to 50, but have high deductible insurance plans. They're willing to pay out of pocket $50 or $100 because they're never going to meet their deductible, right? So, but this is the other barrier, right? Insurance, as a physician, as soon as I sign that contract with an insurance company, I am no longer allowed to charge my patients out of pocket, right? It's crazy. I think it's just, to me, it's just that exists. I mean, here I have a service to provide, right? Like anybody on the Amazon sells something to you, I can't charge people for it. Like, it just doesn't make sense, but that's a barrier, right? I should be able to charge my patients out of pocket. And it's not a level playing field because now you have companies online, right? You have Hims and Hers who sell women's health and men's health products online. You have many websites now that patients can go to, pay a set fee, and they'll provide you clinical care, right? So it's not a level playing field. I should be able to do that for my practice, and unfortunately, because of government and insurance, I can't. So there's a lot of barriers, and that's another barrier about why we can't pay out of pocket. But I would love that for that to be where we go, and it will take a fight.
And if they don't cover it, you still can.
If they don't cover it, then you can accept the payment. If it's not a covered service, But in New York now, for all insurers,
How do you know
it's technically
if it's not covered?
that's the other thing. You have to check if it's eligible, right?
Yeah. They really make a medicine. I tell you, when you were saying it's so complex to bill, you know, and
Yes.
it's crazy what we have to go through.
It's not fair.
It's just not fair. The
Yes.
billing for a service, I think there is nothing out there that is as complex as billing for medicine.
For medicine, no.
Because you go, like you said, you go to Amazon.
Yeah.
Amazon, you pay with the credit card. This is
Yeah.
how much it's gonna cost you. You pay it, you got the service.
Yeah.
But you go to a doctor, you don't know if you're going to be paid. I mean, we don't know if we're gonna be paid.
Exactly.
If we don't call and make sure that we confirm that this person has the, you know, the visa that needs authorization, or that they're still eligible,
They make it very
a lot
difficult to go to the
Yeah.
doctor.
what we go through. So, I mean,
Absolutely.
we're in the business of helping people,
Yes.
but yet, you know, we get penalized with this
Yes.
very complex billing system.
It's frustrating. It's really
Yeah.
frustrating. We're the only industry that doesn't control their cost structure, right? And it becomes very difficult. So that's the barrier. That's a barrier to telehealth. So we're trying to work around it. And one of the reasons we're telling groups to adopt it before the billing infrastructure changes, is because if more people adopt it, the faster we can make that change, right? Once you adopt it and you just do the right thing for your patients, and you start, you know, calling the insurance company and saying we want to get reimbursed for it, the faster that can change, right? So it's hard.
You know,
It's really hard.
Les Brown says, do what's easy and life will be hard. Do what's hard and life will be easy.
Yeah.
So
That's great.
eventually,
Yes.
you know, I know that this is hard.
Yes.
We are doing the
Yes.
hard work.
Absolutely.
But I see a future in medicine. Look, I have this thing that's called the Whoop.
Okay.
The Whoop monitors my sleep. It tells me how deep my sleep was,
Awesome.
how many times I was interrupted during my sleep,
Yes.
what my blood pressure was,
Mhm.
how was it up, was it down, how many times did it,
Absolutely.
you know, so a doctor that is doing, like, you'll be able to get, I'm
Yeah.
thinking this is the future of medicine. If I'm able to get so much data from this little device,
Mhm.
the doctor has the information, let's say,
Mhm.
then you have telemedicine, you don't have to go to the doctor.
Right.
Yeah.
You know,
Right.
you can just have, for most of the procedures,
Absolutely.
obviously, you need a colonoscopy, although they have,
Of course.
I remember they had a pill.
No, they've
At one
with a
point.
camera on it.
Yeah, but at
exactly.
some point, you cannot never
Right.
take the
Of course.
human side of medicine,
Yes.
but definitely we can lower costs.
Yes.
We can, the convenience, and I think people will utilize it even more.
Yeah.
Because to go to the doctor, it is hard
It's hard.
sometimes when you have a
Yeah.
crazy schedule.
Yeah.
And you tend to forget, but
Yeah, no, absolutely. We want to, the human element, it has to be part of it, and that's why we think the relationship is so key. It's something that we get so caught up in technology and, you know, tech is gonna solve our problems. But in healthcare, one of the things we've gotten away from is the idea that the relationship is still important. What we need to do, and what we're doing as a company, is we're using technology to magnify the relationship rather than take patients away from the relationship, right? So you getting connected to your doctor is the most important thing in healthcare. Your doctor is the most
Yeah.
important resource that you have. And if we can create technology to get the two of you connected, I believe we can create a healthcare system with improved quality,
Yep.
reduced costs. And our vision is, it's so funny you mentioned the watch, is when people ask us where do we want to be in 10 years, I believe in 10 years we can have a healthcare system where 75% of all office visits are virtual with your doctor, right? Because that watch right now with our,
Tells a lot.
it
yeah,
tells you a
this
lot.
says so much.
And this is just come out.
Yes.
So once it evolves into something else, you'll be able to see her heart rate and all, and I'm sure it
Yes.
does now. But
Yeah,
more
it
things,
tells me
your blood sugar, you know, there's a lot of
Yeah,
different things that,
so,
Yes.
technology is crazy.
so all good things come to an end.
Yes.
And unfortunately, we have to
Yes.
come to an end because we promised you 30 minutes. But I do have to say, Dr. Virk, you are Burke.
Right.
You are a passionate man.
Yeah.
We love passion, as you could see.
We are.
We are full of passion.
Yes.
So we are so happy to have you here.
Thank
Really,
you.
this was an amazing show. Thank you.
Thank
Thank
you
you
very
for
much
the
for-
information.
No, thank you for having me. It's a pleasure. I always love speaking with you. It's
And we're
great.
gonna keep you posted on the up and coming differences of the things that are happening with telemedicine as we move
And
forward.
remember that we're doing telemedicine
Yes.
very soon. So if you like our show, please do
Remember,
not
like us.
forget, like us, all right? Take care.
See you next
Bye-bye.
week.
Bye-bye.